What it means to be black. In 2020, the death of George Floyd sparked personal and global interest into the treatment of black people. In fact, the reports that came out, public reports, showed that black people were treated adversely, and this had an impact on their health and their well-being. From this, the question is asked, what it means to be black. Today we have a panel of people who will discuss their experiences living in Canada and what it means to be black and what can be done to help us in Canada understand the experiences of black people. I'm going to start by first introducing our panel. With us today we have Greg Burkett, a high school teacher who is currently working on a national project to incorporate black history into the school curriculum. We also have Adideo Agdebola. He's a fourth year student at Toronto Metropolitan University. We also have Alexis Andrew, who is a fourth year nursing student at Toronto Metropolitan University. Listra Bossolale, who is a public health nurse and mother of two, who has a wealth of experience working with black and marginalized families, as well as a recipient of the healthcare system. And also Dupe Duado is the anti-black racism practice integration leads at Children's Aid Society of Toronto and facilitates training in the community. Thank you and welcome you for coming today. And we're going to start off by asking a simple question. And I want to start off with the mill gens, your generation. When we talk about to be black, what does that mean to you? Let's start off with Adideo.
To me personally, being black is people wanting your help until they realize who you are. And I'm going to go into a specific example of working as an extern during COVID. During this time, it was extremely difficult for nurses to perform all the duties just because of the understaffing issues and the large amount of patients. I decided to work on the respirology floor because I heard that my community, Brampton, was hit extremely hard. During this time period, I would go and try to assist patients. A lot of times when I would walk in the room, they would look at me and say like, no, I don't want you. At first, it was like, oh, okay, maybe they're not comfortable with males. It's okay, I understand people have traumas. But after a while, I came to understand that if it was a white colleague, they would have no problem. But then when they saw me, it would be like, oh, no, I don't want you. And it just gets you thinking, but you can't really go and say, oh, is it because I'm black? Because that's offensive. It's the hospital. We have to try to keep it professional. So that's where the idea of everyone wants your help until they realize who you are.
So how have you managed with that?
In all truthfulness, it's been extremely difficult because you look at your colleagues and they don't face the same troubles as you do. And I'm only a student. So now imagine what happens when I become a nurse. If I work in the field for 10 years, 20 years, what kind of experience am I going to have that other people are not going to be able to have?
Have you found support through colleagues or the institution in helping you?
In all truthfulness, I don't feel there's that much black male nurses, especially on the respirology floor. There isn't a single one. So there's not really anyone that can relate to what I'm going to specifically as a black male nurse. Yes, there are black female nurses. There are black female nurses, but I just feel as a black male nurse, the experience is completely different because, for example, a nurse would be like, no, tell the patient that you're the only one who can change them. But then you cannot force someone to let you do something they don't want to do.
Mm-hmm. Thank you for sharing. Alexis, what's your experience?
I feel like I'm biracial, so I think I've always kind of had an issue of kind of how I identify and where I fit on the spectrum. You know, I grew up in a predominantly white area. Luckily, I didn't have a lot of overt experiences of racism, so I'm very grateful for that. But now kind of looking back in retrospect, there's a ton of microaggressions that honestly I didn't even notice until now, really. So, you know, it's kind of been difficult to place myself and like find where I belong in the community, you know, and then having mostly white peers. There's just certain situations that I don't think you'll ever understand unless you are a person of color. So for example, you know, meeting a significant other's family for the first time, if they're white, there's a different thought process that goes through your head that really just doesn't you know, I've had these discussions with my friends before, and you know, they're like, oh, I can't believe that's even something that you think about. Or, you know, like Adedeo said, you know, when you go into a room or you're, you know, having a conversation with someone, you never want to make the assumption going in, oh, they don't like me because I'm Black, or they think of me a certain way because of my skin color. But then it gets to a point where it's like, maybe that, you know, that might really be it. So I think now I see the microaggressions a lot more, or I get, you know, well, you're not really Black. I get that all the time. Or, you know, you're not like certain, you know, and I'm like, what does that mean? Right? Like, what's your intention with saying that? Or, you know, oh, my dad would never let me date a Black guy. He would be so mad if I dated a Black guy. And I go, okay, well, what does that mean? Like, what do you know, it's just all these things. And I kind of ignored it growing up because I was like, you know, okay, whatever. And now looking back in retrospect, there, you know, there's a meaning to that. Why would your dad be angry if you were to date a Black guy? Are your parents mad that you're friends with me? Is there, like, there's a difference? Like, is there something wrong, right? Whereas when I was younger, I just didn't really question it. It was just, oh, okay, okay.
What age did you start to just have this realization of that?
You know, probably in my early 20s. I started recognizing like these things are harmful. What people are saying is harmful. It's not just, you know, you know, it's not a joke. I took it as a joke for a very long time. And then I think now just with the way, you know, the media is speaking about Black people and their experiences, it was kind of just an eye-opener to me, and thinking, you know, these are harmful things. I've been just taking them with a grain of salt. We're not really, you know, understanding what they really mean. And they, you know, people are saying it right to my face. And it's one of those things, then it is the conversation. How do you bring that up in a conversation with someone? How do you say, you know, what you're saying isn't right, when they say it like in such a passive way, you know? So it's hard. Like, it's hard. Yeah,
especially if they're trying to compliment you, like, you're not like those.
Exactly. It's like, what does that mean? I don't know what that means, right? So I think it's, or just even, you know, people saying like, what are you? Yeah. Like, what's your background? Yeah. And, you know, and I mean complete and total strangers that are meeting me for the very first time. They don't even know my name. And they're asking me, what are you? And it's just, what's the significant, like, you know, I don't know. So a lot of things as I've gotten older, I've come to realize are actually, just because I haven't experienced it overtly and, you know, right in front of my face, I'm realizing now, you know, a lot of things probably shouldn't be said and they're not appropriate, so.
It's actually interesting because in speaking to many students, they have not had a history on the history of Black people. And we've been in this country for a long time. I wondered if you can talk to us about that, Greg. Mm-hmm. Why is it important or relevant to teach Black history in a multicultural society?
Well, it's interesting because when you were saying how people are always asking you, like, you know, what's your background? And, you know, people ask me that and I'll say Canadian, and they'll say, no, where are you really from, right? And it's this belief that, or this understanding that someone who looks like me couldn't be Canadian. And I think a lot of that stems from the fact that they believe that Black people are new to Canada and they don't know that we have a history here that dates back 400 years, right? So the first Black person comes to Canada, they believe between 1606 and 1609. And that's a shock for a lot of people to hear that the Black presence goes all the way back to then, right? And then you have the fact that Black people were enslaved in Canada for over 200 years, Black and Indigenous people for 200 years, right? So that's also a shock for people. And then there's this, you know, if they do know anything about the Black presence, it usually starts with the Underground Railroad and that Canada has always been welcoming. And they don't know that at one point in time, things went the other way. That when Vermont was the first British colony in North America to abolish slavery, I believe in 1777, you had black people leaving Quebec, what is now known as Quebec, going the other way to find freedom in the United States, right? So there's always this idea that Canada, first of all, the black presence doesn't go far back. But if they do know anything about it going beyond the 60s or the 50s, then they know the narrative of the Underground Railroad and that it's always been this welcoming place, right? The history of anti-black racism in Canada, again, is linked very much with enslavement. This book here, it's called Policing Black Lives, and it's written by Robin Maynard, and this sort of made me understand the roots of anti-black racism in a totally different light. She said that with enslavement, every black person was a suspect because you don't belong to yourself. So if you run away, then you're actually stealing. You're stealing property because you don't belong to you. You belong to someone else. So then enslavement really was the first time when black bodies are surveilled heavily in public spaces because every black person is a suspect, right? And that ideology or that thinking continues on. And, so when people talk about anti-black racism, they often think of it as sort of this new phenomenon. It started with George Floyd, no. Or it started with Rodney King, no, right? It has roots and it goes way back. And, even my experiences with anti-black racism, being mistaken for being a drug dealer, those kinds of things, or as a teacher and some students not thinking that I might be competent, or even colleagues wondering when I became a guidance counselor, did I get that position because they wanted to diversify the department, or did I get it because I was qualified, right? Those kinds of things. The duality of being black, how I see myself and how people see me, right? All of those kinds of things steeped in anti-black racism go way back and have roots that go back to the 1600s. It's by no means a new phenomenon.
What I want to know from you, and I guess everyone can feel free to talk to this, is how will it impact teaching in schools now, younger children? Because often when you hear the word anti-black racism, there's a kind of, as you mentioned, Alexis, discomfort with black. How are we going to really navigate through that terrain of talking about blackness? What are the barriers that we can really start to come across, or blockades that we will see?
Well, first of all, the biggest challenge that I find in education is everybody wants it to be contained in a month, right? So we'll talk about it, we'll educate you about it, and we're open to learning about it during February. After that, let's get back to the real learning, right? So, for instance, I tried to teach to my grade 12 university prep class, I tried to teach them the Book of Negroes, to do a novel study on the Book of Negroes. And I got this pushback from students, sir, why aren't we doing Catcher in the Rye and all those other books that, the other grade 12 classes are doing? Why are we doing this? And it was this idea then that, I have this agenda, I'm pushing this, this novel on them. And I tried to explain to them, listen, this is legitimate literature. This book is getting all kinds of, awards and accolades worldwide. This is not just some book that I'm throwing at you because I'm black and I think we should learn it. It's a good book, it's a rich book, there's so much that we can learn from this book, and there was pushback. The next year, one of my colleagues decided that she would teach the book as well, and that year I got no pushback. And I think it was because the students thought, well, then it must be legitimate if this teacher who is not black is teaching it, so then it's legitimate literature, right? So it's okay, we'll go ahead and learn it. So those are some of the challenges that we face. Really, there are two reasons why I think it's important. For one, engagement drives outcomes. So if black students are engaged and they see themselves in the curriculum, then they're going to work a little harder because they see themselves reflected in it, and not waiting until grade 11 or grade 12 where there's some specialty course that they can take in order to learn this stuff. It has to be something that's a part of our pedagogy or a part of our narrative or Canada's narrative from the time they hit grade 1 or from the time they're in kindergarten, so that it's not something that's all of a sudden thrust upon them in their senior years in high school, right? It's a part of the fabric of Canada, just like indigeneity or colonization, right? All of that is a part of the fabric of the Canadian narrative. The Black experience or the Black Canadian experience, 400 years of it, needs to be part of that narrative too. And then with education, you know, we find discrimination or we find anti-Black racism in every sector, but I think education is the one that is probably has the longest lasting impact, right? Because you're in this institution for how many years of your life and you believe what the teachers are telling you because they're called teacher, right? So whatever information they disseminate to you, it's truth, right? So those kinds of things shape who you're gonna be, and then they shape who you're gonna be in society, and then they shape society. So it's not only important for the Black kids, but it's important for all kids to understand that the contributions of Black Canadians and the experiences of Black Canadians, so that society reflects the truth, right? And we get a bigger picture and a bigger scope of what Canada really is and what it can be.
How have you felt that, listening to what Craig says, we've dealt with dealing with race in the classroom as adults and the history of anti-Black racism?
I feel like it right now is just on a very surface level.
Extremely surface.
I think in our curriculum in nursing, we talk about cultural competency, you know, humility, all of that, but we talk about it for what, a couple weeks in theory, and then that's it, right? We don't really go into depth about it. We don't, you know, talk about it, implementing it into nursing practice, really. Or if we do, you know, we talk about it for a week and then we kind of forget about it.
And then I also feel that because we all come from different school systems, we come from around the world. Toronto Metropolitan University is an extremely diverse university. When I talk to my peers, they're like, oh, Canada didn't used to have slavery. Canada was always a safe haven for people to come to. And it just shows that how like we are extremely uneducated, and I feel we attempt to, but the resources are not freely given to us. Yeah. It's not part of the curriculum. It's if we want to learn it, we have to go we have to go our own way, do extended readings that are not part of the course. So it just needs to be implemented better into our teaching.
So we've looked at the need to bring it into the school system. We've looked now to look at into the post-secondary system. Mm-hmm. I often think, what is the reflection we see in the institutions? Now, as a nurse, and when you go into the hospitals, and I'd like to touch this point with Listra, as one who works, and you've been through this system, how have you seen manifested all the experiences of not knowing about anti-Black racism or not understanding what it means to be Black? How do you see it play out in nursing?
Yeah, well, I agree similarly. You know, going through nursing school, there wasn't a lot, I felt, that we learned about how to care for Black patients, right? You know, I remember a story with my roommate. She had a placement on the vascular team and certain IVs, and she came home and said, oh, they told me to look for the blue vein. And she said, you know, I had to reflect. How do I find a blue vein on my dark skin? You know, like, you know, and so, you know, all of these things, then I look back and I think, like, the things that we've learned on how to assess patients, you know, looking for rash and the redness of a rash. Well, on various skin tones, Black skin tones, a red rash is not really going to show up on darker skin tone. So I think there's definitely a lack of knowledge and education around how to care for Black patients, right? And unless you're like seeking that information, you know, we're learning as healthcare providers to assess based on the white skin color, you know, look for a red rash or even like cyanosis. You know, I teach mothers on what to look for if you need to take your baby to the hospital. Well, blue around the lips is not going to be blue around the lips for a darker skinned baby, right? So it's definitely a lack of, I think there's a lacking in that, and that is going to be harmful too, right? It takes away from diagnosis of certain conditions and things like that in a manner, a quicker way, so that, you know, that's going to impact your health long term if you're not getting the same sort of quick diagnosis as you should be. So certainly, I think, you know, even from when I was in nursing school, it was definitely a lack of that education around caring for Black patients, right?
As many of us will know, even from the reports from the Public Health Agency of Canada, anti-Black racism has been the driving force, even in healthcare. And what we're seeing is reports that have shown that the wear and tear on our bodies, the stresses on our bodies, that we suffer on another level because of the stress of racism. And I'm wondering if we can talk a bit more of what we see in the healthcare system. And I'm sure we can also talk about, even with children working in CAS, how these impact the Black community, because we're not educated about our history and about our everyday legacy of experience. Can you speak a bit more to that? And even Dupe can talk about how these impacts.
Yeah, well, I think there's a lot of unconscious bias, right? Like there's these stereotype or stereotypical thoughts of how we perceive how to care for Black patients. And, you know, one example that comes to mind is, and this goes back to, way back in history of testing done on Black people around pain, right? That we experience pain differently, right? So, you know, these stereotypes of our skin's tougher or thicker, and so we don't feel pain as much as, you know, others do. And this impacts a huge community here in Canada, the sickle cell community, for example, right? Where it, you know, majority affects Black people. And so some of the complications with that is they get pain crises. And so, and there's reports out there that show that these patients avoid going to the ER because they don't want to be seen as drug seekers or to be mistreated because, you know, it happens. They dress a certain way, they present themselves a way before seeking ER support because they don't want to be seen as, you know, uneducated or seen as drug seekers when they're going for pain management, pain treatment. Can you imagine you're in the worst pain ever and you're thinking of how you're presenting yourself or how, the way you're dressed, the way your hair is when you go to seek treatment? I just, can you imagine that, you know? And, you know, as a mother of children who have sickle cell, I've had to advocate for my son, you know, and as a nurse, I've even had to use that, I'm a nurse, you know, just to like show that I am educated and I know what I'm talking about, to really get the treatment, you know, the appropriate treatment. Why should we have to face that, you know, like because of our skin color, you know, it doesn't seem right, right?
Can anyone speak to that, this dehumanizing, that we will criminalize somebody before just seeing that they have the same basic needs, what it means to be Black?
There's a constant anxiety, right, that you feel as a Black person in so many different spheres that you enter. So we're talking a lot about the healthcare system and what the experience is, but I think it's in a lot of our interactions, that constant anxiety and worry when we see a police officer, the anxiety and worry when we're in the mall and are just wanting to shop and mind our own business, that is somebody now watching me, how am I gonna hold these items in my hand so people are not thinking that I'm trying to steal? And so I think that does weigh on the body, right? It weighs on the body day to day. I think even for children, they start having those experiences really young, where they now start developing an anxiety, a worry, a fear around how they're going to be perceived, how they're going to be treated by a lot of different systems. And so I completely agree. I know that I have that as well. And even sort of reflecting on my experiences with the healthcare system as a person that has lupus, a person that I know that it's very common and prevalent within the Black community and is very difficult to diagnose, that going through that process of even my diagnoses, having different doctors shut the door on me, not take the worry seriously, not take the pain, the stress that I was feeling, the different symptoms I was feeling. And interestingly, it was actually my sister, who's a doctor, that diagnosed me and said, I think that you actually have lupus. And I presented that to my doctor, and after 2 years was when they finally like, oh my goodness, you do have lupus, and they started doing that testing. And so I think that's just one example. I see that play out as well too with my family members and friends, where we're just not taken seriously, and I think that leads to deep-rooted anxiety, right?
And that speaks a lot to how we have to deal with this ongoing, just to be Black. We wear it every day.
That's right.
But is there a way that we survive, or we thrive, or do we thrive? That's my question. How do we survive this? I don't know what the right words to use sometimes, but
Resiliency, yeah.
Resiliency.
I think there's resiliency, you know, and whether that was, you know, given to us from our, you know, our ancestors or what, you know, it's a resiliency, but it does get exhausting, right? You get tired, you get exhausted, right? This mental wear down of, you know, having to think twice, or, you know, look at things and question, you know. And so there is that resiliency, but, you know, I can see how we do suffer too because of that mental exhaustion and in dealing with these issues, right?
Yeah, and even as I think about that more, I certainly believe, yeah, there is so much resilience and strength to the Black community, to Black people, that are often overshadowed, right? And so I even reflect on some of my own experiences and how I developed my own personal resilience. I remember being a Black Nigerian child of immigrant parents growing up, and you know, seeing so many negative messages about my identity. And that would be in the media, where I wouldn't see anyone that looked like me on TV shows. I would go to school and have people calling me names, making fun of my lips, making fun of my hair, and how I looked. Even from teachers wanting to say this kid has ADHD and different things like that. And so I think due to so many of those negative messages you get, you can start to really question, like, am I great? Am I wonderful? Am I a good person? But, you know, in terms of the resiliency, for me growing up, there was like two key, I think, defining factors in terms of my upbringing that really helped promote my own personal resiliency. One of which was just education from my parents, which I call racial socialization, which essentially was them giving me a talk and letting me know, listen, people are not going to treat you the same because you're Black. And having to have those difficult conversations with my family from when I was 7, 8 years old. And as you reflect, maybe you might not have had some of those conversations and it was a bit different. But for me, my parents had to really sit me down and have some of those difficult conversations, given all of these negative messages that I was getting. And so apart from that, also my parents really focusing on promoting my positive self-esteem, my own identity, and the amazing things about being Black, being Nigerian, right? And so, you know, them searching high and low for toys, for dolls that looked like me. I remember watching Fresh Prince of Bel-Air and being like, oh my God, this is amazing to see Black people in this light. And that really shifting the narrative and making me realize, like, wow, it's amazing to be Black. It's wonderful. I love the skin that I'm in, right? And so we've come such a long way. I think of where things are at now, where you go and you look on TV and you see so many people that look like you. And the crazy part of it is that's the true nature of the Black community. That's really what we are, but we just have not been highlighted or seen like that on TV and in the media. And so I think it's really wonderful to see a lot of the movement and the progress and a lot of the resistance now as well, like things like Black Lives Matter, even now having different conversations about the curriculum, right? And what we can really do differently to educate young people, people that are doing post-secondary education as well too. And so all of those things I think kind of fit into individual resilience, but also a collective resilience and power and strength that you see of the Black community, which is the truth. We are a people that are strong, that are wonderful, that are amazing, that are scientists, that are doctors, that are nurses, that are astronauts. And that's really the true reflective nature of the community, but it just hasn't always been highlighted historically.
When I look at, my dad coming here as an immigrant, my grandmother coming here as an immigrant, and then, the history of my ancestors being slaves, to be sitting here now in the position that I am in and to be so privileged to be, educated and here. And I think if that doesn't show resilience and strength in from Black people, from being from where we were to where we are now, through all the adversities and all the challenges and all the oppression, I think that just shows, to be here today and there's still a lot of work to do, don't get me wrong, but that really shows strength. Even just hearing the stories that my grandma tells me, and we're all in the same life, from, when she was born till now, and the opportunities that she speaks to me and my cousins and family about, she couldn't have dreamed this for her grandchildren. So I think that shows a lot of strength and resilience.
Just thinking, I asked a few people who are Black, what does it mean to be Black? And I had different words. Some words were struggle. It means an emotional deficit sometimes. But I also had words of having no power but exceeding with something. But there's one that I liked, and I'm going to read that one. And it said, endless possibilities in the face of embedded systemic limitations. So when it seems impossible, we still have a possibility that we fight for. If you wanted to be remembered as to have a legacy, and you had to make a statement or a word, what would you like to be known to the next generation, or that would say to someone what it means to be Black?
What I would like to be remembered by specifically is never allowing anyone to tell you that you can't. Specifically because there's a lot of you shouldn't do this, you can't do this, you're not made for this, but why am I not?
Thank you. Anyone else wants to share?
For me, it would be multidimensional. I feel like the way we are represented in the media, we always come across as one-dimensional, particularly, I don't even want to say just Black males, Black females. This stereotyped, prepackaged identity, you're going to be an athlete, you're going to be a rapper, all those kinds of things. I want my legacy to be that I was multidimensional. I wasn't what others said I should be or could be or can be. I want people to know that I like basketball and I listen to hip hop, but I'm also educated, right? And I'm also into other things too. I can listen to classical music too. I can watch a hockey game too. I don't fit neatly into these packages. I'm multidimensional.
For me, it's just not letting anyone dim my light. I want to be vibrant. I want to be myself. Yeah, and I just want to, enjoy my life and be kind to people and be remembered as doing that. So,
yeah, these are all great. I agree. I think I would choose all of this. And also to just feel empowered or feel like you can, right? There is no I can't. That empowerment to achieve that, to go beyond what you think you can do more. You can always do, right? So just that empowerment of you can go beyond, yes.
I think for me, I want to be remembered as somebody that's unapologetic about fighting and standing up for social injustice. And I think just as you were kind of talking of that, people try to sort of put you in this box, right? And even in terms of just being Black, you always have to be so mindful and on guard and have this double consciousness, like, I have to make sure that I'm polished and perfect, but I want to be unapologetic. I want to be myself, and I want to be embraced for that. I want to stand up against injustice, and I want to be apologetic about that. And so that's definitely what I want to be remembered for, being unapologetic about being myself.
I love the word unapologetic. If I had to choose something, I think it would be I am Black. And with that comes a legacy of freedom fighters, in spite of the barriers. I'd like to thank you all. It's been really enlightening. And let us all go with what we know who we are, what it means to be Black. Thank you.